thank you for choosing us to take care of you and your loved one. We will be providing information on how to prepare for your upcoming total joint surgery, expectations for recovering at home, physical therapy exercises and the need for home care, outpatient therapy, and durable medical equipment that may be utilized in the home. It is the hope this presentation will promote independence and active participation in your care and decrease anxiety over your upcoming surgery and answer any questions you may have. Beaumont Royal Oak is ranked number 2 in Michigan and number 2 in Metro Detroit by U.S. News and World Reports. Beaumont Royal Oak ranks 21 in orthopedics nationally. We are ranked high performing for total hip and total knee replacements. We are a magnet hospital, which is the highest honor for nursing excellence. In 2021, our total joint volume exceeded a little over 2,200 cases.
Now we're going to be talking about the treatment options for arthritis. And when we think of treatment options, we think of both surgical and non-surgical forms of treatment. Obviously, we like to start with non-surgical forms of treatment and progress to surgical forms of treatment as needed. Now, number one under non-surgical treatments is going to be weight loss. So weight loss is super important both for your joints and your overall health. The less weight that you have on your body, the less force that goes through the joints. And the less force on your joints, the less pain you'll experience with your activities. Additionally, weight loss can actually decrease the rate of progression of arthritis. So your arthritis progression won't happen quite as quickly. Next, we have exercise. Now, exercise is extremely important, and that works because it increases the strength of your muscles, your tendons, and your ligaments around the knee joint, which can help protect it during exercise. So it's similar to losing weight, where you want to decrease the force on your bones, and you can do that by either losing weight or strengthening your muscles. We prefer a combination of both. Next, we have physical therapy, in which you'd go to physical therapy, meet with a physical therapist, and work on exercises aimed at decreasing inflammation around your joints. Next, we have walking aids. So the two different walking aids that we would recommend are both a cane and a walker. If you're going to use a cane, use it in your opposite hand. So if you have left knee arthritis, you'd use it in your right hand. And additionally, a walker. And so these aim at decreasing the force that goes through your joints. You can see a common trend here. Finally, we have injections. And injections are used to decrease pain. Now, they don't actually treat the disease. They just decrease the pain associated with it. And so the two injection options that we use most frequently are cortisone injections, which decrease inflammation in the joint, and gel shots, hyaluronic acid injections, chicken shots, rooster comb shots. They go by a variety of different names, and those act by increasing the lubrication in your joint. There are some other injections options available, like stem cells and PRP injections, and I would recommend that you talk to your physician about that. Next, we have surgical treatment options. So once the non-surgical treatment options have been failed and you continue to have pain, we would talk about a partial knee replacement, a full knee replacement, or in the case of hip arthritis, a total hip replacement. Here we have what a knee replacement actually looks like. And on the far left, you see a healthy knee. You see a femur, a tibia. Those are the two main bones that make up the knee joint, and then your kneecap or your patella. On the ends of the femur and the ends of the tibia, you have cartilage. And this is what's destroyed in arthritis. And so the second picture over in the arthritic knee, you can see that healthy blue cartilage has been replaced by angry red blood. And so that cartilage gets degraded over time and it starts to show bone. And so then after you've lost all your cartilage, it turns into a situation where you have bone on bone arthritis. Next, we have a partial knee replacement, and you can see the partial knee replacement there in the gray. And that only encompasses one portion of the knee, typically the inside of your knee. But it can be done on the outside as well. And so you see you keep part of your knee and the bad part of your knee is replaced. Now, not everyone is a candidate for a partial knee replacement. Talk to your physician about that. Next, we have a full knee replacement where both sides and the kneecap are replaced with metal and plastic. You see you have a piece of metal on the femur here, a piece of metal on the tibia, and then a piece of plastic right in between the two. Shows the anatomy of a knee on an x-ray. And so what you want to see is healthy joint space in between the femur and the tibia. Now you can't see cartilage, but when you see space, that means that there is cartilage there. Now on the x-ray on the right-hand side, indicated by the star, you can see that you've lost that space and now it's turning into a point where the bone is touching the bone. Here we have an x-ray of what a full knee replacement looks like on an x-ray. And so on the left two pictures, you see a knee that has bad arthritis. It's bone on bone. And on the right, you can see your finished knee replacement. And so the white is your new knee. In between the two white pieces, if you'll remember, is a piece of plastic, and that doesn't show up on the x-ray, but the space in between the two components is where the plastic resides. So people often worry about having metal in their body. What does that mean to me? Will I be allergic to it? Can I have a reaction to it? And so that's what we're going to talk about next. Now, obviously, people like to travel, and you can travel with a knee replacement without any difficulty. Will you set off a metal detector at the airport? The answer is possibly. If this happens, they put you through a protocol, and usually they'll put you through the fancy spinner machine and just confirm that you have a joint replacement. Now, rest assured that they have protocols for this. They have thousands of patients at Detroit Metro going through the x-ray scanner with joint replacements every single day. So don't worry about it. Everything will be okay. And they should move you through expeditiously. We used to give ID cards, but TSA does not recognize those as valid forms of identification that you have a joint replacement anymore because they're easily forgeable. So there's no point to having any sort of ID card saying that you have a joint implant. Just give it make sure you plan ahead, give it a few extra minutes, and you'll be fine. Next, can I have an MRI? Absolutely. So you can have MRI scans with joint replacements without a problem. They are all MRI compatible. Can you be allergic to metals? Now, they are exceedingly rare. Now, obviously, if you have had a reaction to metal jewelry in the past, tell your physician. But I can tell you that in my 8 to 10 years of practice, I have never actually seen a true allergy to a metal implant. But again, discuss with your surgeon if you're concerned. And some female patients are concerned about the weight of the implant, and it weighs about 1 to 2 pounds. So if you're tipping the scale a little bit after your surgery, you can always blame it on your joint replacement. Now, next, we're going to touch upon potential complications, and I want you to know they happen very rarely. Joint replacements are very safe, very effective, high success rate surgery. That's why I chose to go into it. People are generally very happy after their joint replacement. Now, every once in a while, a complication does happen, so you should know about what the potential complications are. First and foremost, we have infection, and so that's where your soft tissues or the joint replacement gets infected, which can be treated with antibiotics and or another surgery. Now, I want you to know this is very rare. At Corewell, we have a very low infection rate. We pride ourselves in our sterility and our surgical technique. So we strive to make this number as low as possible. In fact, we keep a very close eye on it. If anything starts looking awry, then we hit it head on immediately. So we do not have a problem with infection. Our infection rates are amongst the lowest in the state. Next, blood clots. Blood clots are rare, mostly because we treat you with blood thinners after surgery. So certainly let us know if you have a history of blood clots in the past, but we will give you blood thinners after surgery to help prevent blood clots. Finally, next, we have stiffness. Now, this is more common after knee replacements. It's when your knee doesn't bend as much as you would want it to. This can be somewhat prevented by engaging in physical therapy aggressively after surgery. There are treatment options available if your knee doesn't bend quite as well as you want it to. So discuss this with your surgeon. The best advice I can give you is try to maintain your range of motion before surgery. So if you start to see that your range of motion is becoming limited, then you might want to discuss surgery sooner rather than later. Next, continued pain. So This is more common in knee replacements than hip replacements. You can have a degree of pain after surgery. We shoot for 100% pain relief, but some patients continue to have a pain on occasion after a joint replacement. 95% of the time, the pain is much improved compared to the preoperative status. The reason for the pain could be multifactorial. You will never have arthritis-related pain after a joint replacement. That is impossible, but the parts of the knee that weren't replaced can still get pain. So you can get tendonitis, bursitis. Usually this is treated with physical therapy. Next, nerve injury. This is extremely rare, especially after a knee replacement, perhaps 1 out of every 1,000 cases. It's something to be aware of, but it is extremely rare as the nerve is quite far away from the area that we are working. Finally, we have problems with the prosthesis. These would include loosening, where the prosthesis debonds from the bone, which can be treated with surgery. Instability, where the knee feels a little bit more unstable than it otherwise would or should, and this could also be treated with either brace, physical therapy, or surgery. Dislocation, this isn't as much a problem with knees as it is hips. Your knee should not dislocate, so that's nothing to be concerned about. Finally, we have wear of the prosthesis, and so people ask me, how long is the prosthesis going to last? I typically tell them 20 to 30 years, but this might be a lowball estimate. We don't know how long our knee replacements are going to last. We have made significant improvements in the previous years, and I every once in a while will see a knee replacement from 20 or 30 years ago that was put in and is still functioning quite well. So I believe that your joint replacement will last a very long time. If it does wear out, it's usually the plastic in between the two pieces of metal that wears out, and that can be changed with an easy surgery.
On the day of your surgery, your anesthesia team will consist of an anesthesiologist and a nurse anesthetist or an anesthesia resident. The anesthesiologist will meet you in the preoperative area and review your medical history and prior anesthesia history and do a focused physical exam. The anesthesiologist will then select and discuss the best option for anesthesia for you for your surgery that day. The types of anesthesia that may be used during your surgery may be general anesthesia or regional anesthesia in the form of a spinal. General anesthesia causes you to be completely asleep during surgery with the use of intravenous medications and inhaled anesthetics. A breathing tube is placed after you're asleep, and a ventilator is used to assist your breathing during surgery. The breathing tube is removed before you are fully awake. You may have a slight sore throat afterwards. Regional or spinal anesthesia involves placing an injection of numbing medicine in your back that will numb your body from the waist down. You may receive some light sedation for the placement of the spinal, and more IV sedation will be given during the surgery so you will not be awake. No breathing tubes are used during a spinal anesthetic. You breathe on your own, and we give you supplemental oxygen with a mask or a small device that rests on your nose. To help lessen pain after surgery, a type of therapy called a nerve block may be used. This involves an injection of local anesthetic close to a targeted nerve or group of nerves in your leg. The nerve block is performed by the anesthesiologist or anesthesia resident in the preoperative area before you go to the operating room. Light sedation is given for this procedure. The nerve block may be a single injection with numbing effect lasting 12 to 18 hours, or a continuous nerve catheter may be placed and connected to a pain pump with effects lasting 3 to 4 days. This type of therapy will not cover 100% of your postoperative pain, but will significantly cut down on the amount of pain medication you have to take orally or through the IV.
My name is Luann Cathers. I'm the clinical nurse manager for the pain management team. I'm here to discuss and talk with you a little bit about postoperative pain management, specifically peripheral nerve catheter infusion of pain medication. So the peripheral nerve is, or more commonly known as a pain pump, is an optional method for pain control after your knee surgery. It is done preoperatively A small tube or catheter is placed into the thigh area on the side that you're having surgery. It's placed by an anesthesiologist using an ultrasound to guide the placement. After the catheter is in place, the doctor can give a good dose of numbing medication to be used during the surgery, and the continuous pain pump part is started immediately postoperatively in the recovery area. The pain pump medication should last about 3 to 5 days. And you can anticipate that it will provide another level of additional pain management for the top part of your knee. It does not cover the pain on the sides or behind the knee. You will need to use prescribed pain medication or over-the-counter acceptable pain medication to help with that pain. There is an extra round button that you can see on the pain pump that you may press every 30 minutes to give yourself a safe dose of extra medicine. The window that you see, which is blank in this picture, while the pump is running, will have a number displayed there that will continually be increasing, going up. Once it has reached its max, the pump will alarm, and that's how you'll know that it's empty. And again, that treatment usually lasts 3 to 5 days. The pump or tubing is easily removable by the patient. You start by taking off the tape that has secured the tubing to your leg. Start in a corner and gently peel off all of that tape, and the tube itself will stick to the tape and should slip right out, kind of like a wet noodle. There's no need for a bandage. There should be no bleeding. Keep in mind, while the pump is infusing, your leg may be numb or heavy. This could be just on the top part of your knee, but it could be in the thigh area as well. So extra precaution is taken while moving about. This can be in the form of a knee brace that is worn for the duration of the pain pump treatment and will be ordered by your surgeon, and you will be advised on how long to wear that. But generally the length of that treatment and for 12 to 24 hours after that is removed. The advantages of having the pain pump is it reduces the need for extra pain medication and the side effects that go with that pain medication. It also increases your ability to have productive physical therapy sessions as your pain is better controlled. And of course, it helps you get ready to go home and feel comfortable at home. If you have any questions during the use of the pain pump, there is a team member available 24/7 to contact for assistance. This is an extremely helpful tool that many patients have found impactful in reducing their postoperative pain and helping them recover quicker. And we're confident that you will have the same experience.
Preparing for your surgery. The actions you take prior to your surgery can improve the success of your surgery and increase your satisfaction with your surgical experience. First, it is important to identify a support person who can be the most important member of your team. They will need to be available to drive you home after surgery and offer support after discharge from the hospital. It is important to make sure you are in your best health to reduce medical and surgical complications. You need to stop smoking, vaping, and using any nicotine products. Smoking can damage blood vessels, impede healing, cause infection, and lead to breathing complications. Try to reach an optimal weight, which will make surgery and therapy easier. Stay active and start exercising to be strong enough for recovery. Building arm and leg strength is important to aid in the use of the walker after surgery and build muscle mass. Maintain a healthy diet. Let your primary care provider or any specialist know you are having surgery to obtain necessary health clearance. Stabilize your blood pressure and try to get hemoglobin A1C below 8. Stop drinking alcohol 6 weeks prior to surgery. You also need to see the dentist 2 months before surgery. You must have no active gum disease, cavities, infections, or loose or broken teeth. You will need to wait 3 months after surgery to have any routine dental work completed. And make sure to inform your dentist of your joint replacement. Schedule any vaccines at least 2 weeks prior to surgery, like your COVID, pneumonia, or flu. You may be asked to stop some medications prior to surgery. This may include blood thinners, like aspirin, Plavix, Coumadin, Xarelto, Eliquis, vitamins and herbal supplements due to an increased risk for bleeding. You should consult the prescribing physician for instructions. Also, NSAIDs like Motrin, ibuprofen, Advil, Aleve, naproxen, Voltaren should be stopped 1 week prior to surgery. You can use Tylenol, though, for pain control. Lab work will need to be completed prior to surgery at Beaumont Laboratory. A nasal culture will also be taken at this time. The culture will determine if you have the bacteria Staphylococcus aureus present in the nose. Staph can cause an increased risk for infection. If positive, you will be treated with certain antibiotics preoperatively. You will be asked to shower with chlorhexidine gluconate, CHG soap prior to surgery. The soap is a surgical skin cleanser which kills bacteria and decreases the chance of developing a surgical site infection. Shower with the soap 2 days prior to surgery and the morning of surgery. Apply the soap to a clean washcloth. Clean your body with the washcloth, especially the area that will be operated on. And to avoid your face, eyes, mouth, ears, privates, and open wounds. Allow the soap to stay on the body for about 3 to 5 minutes and then rinse. Dry with a clean towel and wear clean clothes or pajamas daily. Sleep in clean sheets on the first day that you start using the soap. Do not use lotions, creams, or powders. You will receive several phone calls from the hospital prior to surgery. Hospital registration, they will want to know your contact information and insurance information. Anesthesia pre-screening, usually a day or 2 prior to surgery to obtain a health history. At this time, you will be asked to provide a list of your medications you are currently taking. Please carry a list with you. And surgical scheduling. Afternoon, the day prior to surgery for your arrival time and parking instructions. When packing for the hospital, do not bring valuables, jewelry, or your own medication. Bring a picture ID, an insurance card, form of payment for prescriptions, CPAP machine, advance directions if you have one, personal toiletry items, walking shoes, comfortable clothing, cell phone, and charger. Stop eating solid foods the night before surgery at 10 p.m., and that includes gum, mints, and candy. You may have clear liquids up until 2 hours prior to your arrival time, and that can include water, black coffee, tea, soda, juice without pulp. So that means no cream or sugar or honey in your coffee or tea. Remove all jewelry, piercings, and contact lenses, and take only the medications instructed per anesthesia pre-screening. On the day of your surgery, you will be asked to arrive 3 hours prior to your surgical time. If you are getting a cold, flu, fever, or any illness or an infection the week before surgery, contact your surgeon as soon as possible. If you need to cancel the night before or the morning of, notify your surgeon's office and hospital at 248-898-5000. You will enter the hospital through the south entrance and check in at the information desk. Then you will take the gold elevators to South Tower Surgical Lounge and check in at the desk. You will then be brought to a pre-op room to be prepped for surgery. Your companion will wait in the surgical lounge and then be brought to pre-op when you are ready for surgery. You will change into a patient gown, sign consents, have an IV started, and additional labs drawn if needed. Receive a betadine swab of the nose and have your surgical site cleaned in additional time. You will meet your surgical team and have the opportunity to ask any questions. The surgeon will initial the operative site in the pre-op area. The questions asked by staff may seem repetitive, but it is for your safety. Texting updates will be available for your companion during surgery, and monitors available in the surgical lounge to track the progress of surgery. Everything is done to start your procedure on time. However, delays can occur due to emergencies. We apologize for any delays and appreciate your understanding. You will be given medication to make you drowsy and relaxed. You will not feel pain during the procedure. Your heart rate, blood pressure, and oxygen and temperature will be monitored continuously. The surgery will last about 1 to 2 hours, and the surgeon will speak to your companion after the surgery is completed, as you are transferred to the recovery room. You will remain in the recovery room for 1 to 2 hours for monitoring. You will wake up with oxygen in your nose and monitors in place and be observed by specially trained nurses. You may feel sleepy, have a sore throat, or feel sick to your stomach. Medications are available for pain control and nausea. You will be offered ice chips and something to drink if tolerated. You will be reunited with your support person in your hospital room. As stated before, you will start with ice chips and liquids and advance to a regular diet as tolerated. Menus are available in the rooms for food service. It is advised you eat before starting therapy. You will find the staff using hospital-issued iPhones for communication. It is safe to discharge to home on the same day of surgery, and this is usually prearranged with the surgeon. 95% of patients are discharged to home instead of a rehab facility. You will be able to be discharged to home after passing therapy goals, and pain is controlled to an acceptable level. If you do not go home on the day of surgery, the expectation is to stay 1 night. A longer stay needs to be medically indicated. A ride for discharge should be prearranged. Most people do experience pain after total joint surgery. The nurses will regularly assess your pain by using the pain scale below. There are multiple types of pain medications available, and the goal is to lessen the discomfort so you can participate in therapy. Pain meds are encouraged to be taken around the clock the very first few days after surgery. Pain meds are taken approximately for 2 weeks for knees and 1 week for hips. Prescriptions can be sent to your pharmacy of choice or filled here at the Beaumont Outpatient Pharmacy and delivered to the bedside with our Meds to Beds program. A form of payment is needed. Using a pain medication journal at home is helpful to track pain meds. An example is present on the next page. Always refer to discharge instructions for medication clarifications. Do not stop pain meds suddenly. Gradually decrease the amount and frequency by breaking them in half. Be sure to call the surgeon's office for refills 48 hours in advance. The surgeon is the only one to refill your medication. Also consider non-medical techniques to control pain, such as meditation, music, and calming breaths. It is important to stay ahead of your pain. This will help you keep track of how often you are taking pain medications and can guide you on when to wean your medication. Remember, there are several different types of pain medication that can be taken in combination to treat pain. Remember, the strongest pain medication should be taken for the shortest amount of time. Limit Tylenol to 4,000 milligrams per day from all sources. The goal is to be finished with pain medications within 7 to 10 days after surgery. Wean medication by spacing out the dose. Here is a flyer from our discharge medication program, the Meds to Beds. Be sure to bring your insurance card and form of payment to have discharge medications delivered to your bedside. You will be encouraged to use your incentive spirometer 10 times per hour while awake to expand the lung and prevent pneumonia. Put your lips around the mouthpiece, breathe in with slow, deep breaths. Ice packs will be provided in the hospital to reduce swelling and pain. It is best to use ice at least 3 times per day for 20 to 30 minutes at a time. Do not place the ice pack directly on your skin. Place a towel over your skin, then the ice pack. Continue this practice at home. Swelling is expected after surgery. Swelling is greatest the first 2 weeks after surgery and can last up to 6 months. Swelling can be common in the groin, thigh, leg, and foot. To relieve swelling, elevate your extremity on a pillow placed under the calf and ankle. Avoid placing pillows under the knee. Bruising is also common the first week after surgery and can take several weeks to resolve. Constipation is a common side effect from pain medication and anesthesia. Take the stool softener twice a day to minimize constipation. Drink plenty of water and eat a high-fiber diet. Additional over-the-counter medications can be used, such as milk of magnesia, Miralax, or prune juice. Meplex dressing is a silver dressing. It can be removed 7 days after surgery. You are able to shower with the dressing in place. Do not apply creams, lotions, and powders to the incision, and avoid tub baths, swimming pools, and hot tubs until seen by the surgeon in the office. A small amount of drainage on the bandage is normal, but anything increasing or covering more than 3/4 of the bandage should be reported to your surgeon. Discharge instructions. Upon discharge home, schedule a follow-up appointment with your surgeon for 2 to 3 weeks after surgery. Make sure you are continuing the exercise therapy worked on with you. Continue to track your range of motion and therapy progress to report to your surgeon. You will be provided with approximately 1 week of pain pills. Remember to give your surgeon 48 hours notice for refills. Continue to take your blood thinner to avoid blood clots. And remember, constipation is normal, and take the stool softener twice a day. Your surgeon will determine when you can resume driving at your follow-up appointment. You must be off your narcotic pain medications and regain normal reflexes and strength. Expect to return to work in 8 to 12 weeks. Also, poor sleep patterns are normal after joint surgery and can last for several weeks or months. When to call the surgeon. Again, it is normal to experience mild constipation, swelling, and stiffness that may worsen as you increase your activity and some bruising. Contact your surgeon for increased pain that is not relieved with prescribed pain medication, ice, and rest. Only the surgeon can authorize refills for pain medication. Call if you suffer a fall or have no bowel movements for 3 or more days, or have abdominal pain, nausea, or vomiting. Call for severe leg swelling, not improved with elevation and icing, or if your incision shows signs of infection, including redness, swelling, warmth, or drainage. Notify the surgeon for a consistent elevated temperature above 101.5 for over 24 hours. Call for pain, redness, or warmth in the calf or thigh or bleeding from the incision that will not stop after holding pressure. You should call 911 for chest pain, shortness of breath, or slurred speech. PROS, or Patient-Reported Outcome Survey, is a tool used to evaluate pain, functionality, and quality of life for hip and knee patients undergoing total joint arthroplasty. The initial survey is taken prior to surgery in the surgeon's office or in the pre-op area. Consecutive surveys are sent 5 to 13 weeks after surgery, 9 to 13 months after surgery, and 2, 5, and 10 years after surgery through email. The results before and after surgery are compared to aid surgeons in determining what practices work best for their patients. The information is useful to improve patient outcomes, so please take the surveys when they are received.
Therapy services. Total knee precautions. While your muscles and ligaments heal following your surgery, it's important to follow the precautions given by your surgeon or therapist. These precautions protect your new knee and prevent dislocation of the joint. Sit in a firm chair with armrests so you can use your arms when standing up. Avoid kneeling and squatting soon after surgery. All of the following exercises should be done as tolerated before and after surgery, unless otherwise instructed by your surgeon or healthcare provider. Exercises that are in the lying position should be performed in bed or on the couch. Please do not attempt these exercises on the floor. Standing exercises should be done holding on to the sink or counter. If you feel unsafe or unsteady while standing with support, please do not attempt the standing exercises. Your pre-surgical goal for each exercise is 3 sets of 10. You may do them all at once or break them up throughout your day. If you are experiencing abnormal pain during an exercise, please discontinue that exercise until you meet with your healthcare provider. Ankle pump. Bend ankles to move feet up and down, alternating feet. Heel slide. Bend surgical knee and pull heel toward buttocks, then repeat on opposite leg. Short arc quad. Place a rolled towel under leg, straighten a knee and leg while keeping leg on roll. Hold 3 to 5 seconds. Repeat with other leg. Quad set. Slowly tighten thigh muscles by pushing knee down into bed. Hold 5 seconds, then relax. Glute set. Squeeze buttock muscles. Hold for about 5 seconds, then relax. Heel rises with counter support. Start with feet shoulder width apart. Raise heels off the ground. Hold briefly, then return back to floor. Standing march with counter support. Lift knee toward waist, then return to starting position. Repeat on opposite leg. Mini squat with counter support. Start with feet shoulder width apart. Bend your knees to lower into a mini squat. Hold briefly, then return to upright position. Standing hip abduction with counter support. Lift leg out to the side, then return to starting position. Repeat on opposite leg. Sitting knee extension. Straighten surgical leg and try to hold it for 5 seconds. Repeat on non-surgical leg. Standing hip extension with counter support. Tighten buttock muscle and lift your leg backwards. Then return to starting position. Repeat on opposite side. Medical equipment. After your surgery, your therapist will recommend using the following equipment. These items are not covered by insurance. However, they will add to your safety and independence after surgery. When possible, purchase these items prior to your surgery. All items can be purchased from vendors such as Amazon or any DME supply company. You may also contact your local community or senior center for resources on loaning equipment. Hip kits may be used to assist with your recovery. These include items such as a reacher, long-handled shoehorn, long-handled sponge, sock aid, and dressing stick. Shower chair or transfer tub may also be used after surgery. A shower chair is used for walk-in showers, a transfer tub bench for bathtubs.
Your discharge plan from surgery. We are here to assist you with your transition from the hospital to home. We will meet with you the day after your surgery. Most surgeons prefer that patients return home after surgery. We recommend you have someone with you for the first 2 to 3 days after surgery. If needs are identified after surgery, your surgeon will order the services and a care manager can assist in arranging them. These include medical equipment, home care, or skilled nursing facility. There is certain medical equipment that is recommended. You may choose any medical equipment company you would like to service your needs. Most patients will need a two-wheeled rolling walker and a standard cane post-op. This is a walker with two wheels in the front. Four-wheeled walkers are not recommended as they are considered a fall risk. Most insurances cover a walker or a cane every 5 years. If you need a two-wheel walker, arrangements will be made to have it delivered to your room and be ready for you to take home when you are discharged. Home care services. When you are discharged home, the surgeon may order home care services to continue to monitor you post-operatively. We will be arranging those services for you. You are free to choose your own home care agency. The surgeons also have identified agencies to choose from as well. Services may include an RN and/or physical therapy. Your surgery will guide which services will be seeing you after surgery. Skilled nursing home placements. If rehab is recommended, insurances including Medicare, Medicare Advantage, and commercial plans have various guidelines pertaining to your admission in a rehab facility. A care manager will inform you of those guidelines and if you qualify. If you qualify, we do recommend that you choose at least 3 facilities in case your first choice does not have a bed available. One of our care managers will meet with you post-operatively to obtain your rehab facility choices and begin the process of arranging a bed for you at one of the selected facilities. You must have your family transport you to the facility, or you can privately pay for a wheelchair van service to transport you. Wheelchair van services are not covered by insurance, and you will have to privately pay for them. Most companies will request to be paid in advance by cash, check, or credit card. We will do our best to honor your choices. Due to many factors such as bed availability and care needs, if the facilities you choose are not accepting the referral, facilities not on your choice list may need to be utilized as the facility you will be discharged to. Reminders: actions taken before surgery can increase the success of surgery and overall satisfaction with the surgical experience. Home is the best place and safest place for you to recover. A quicker recovery leads to less complications.